Good morning and welcome to Healthworks. I'm Carol Kanier, Community Relation Manager for Wayne Memorial Hospital. Thank you for joining us today. We are in April, and for those of you that may not be aware, April is Occupational Therapy Month, and my guest today is Kathy Neenan. Good morning, Kathy.
Good morning, Carol.
And Kathy is a licensed occupational therapist here at Wayne Memorial Hospital, correct?
Correct.
So I know we're going to date ourselves. How long have you been at Wayne Memorial?
As of last September, it was 37 years. A few.
Yep, just a few. Mm-hmm. Yeah, you're a little ahead of me because I just did my 33rd year in March.
Yes.
I know, but it's a great place to work, right?
I would say it's very supportive, yes.
Yeah, and the people that we've met over the years, and it's just been wonderful.
Mm-hmm. Well, it's very nice because I've gotten to work in some different avenues, whether in the hospital, I've been in outpatient, I did home health for a while, and also work in rehab. So that has been very varied for me.
Yeah, exactly. Which is a great experience. And so, so you are an occupational therapist, and each year they kind of change the theme, right?
Correct.
So what's this year's theme?
Okay, this year's theme is enriching lives through meaningful engagement, which speaks volumes because occupational therapy is what you do in a day, what is important to you, your values, what you need to be involved in with caring for a family member, caring for yourself, being involved in work. So all of those things, you can do daily tasks to keep yourself in line, to keep yourself healthy.
Right.
Your well-being.
Mm-hmm. And that's something you do every day that you work, and probably in your personal life as well, I'm sure that carries over. So when we look at occupational therapy or an occupational therapist is what you are, first of all, you mentioned a little bit, what does an occupational therapist actually do?
Okay, so our interventions use everyday activities, your life activities, your occupation. In other words, we promote health, well-being, and your ability to just completely safely participate in your daily tasks. And that is taking care of yourself, going to work, being active and participating in school, volunteering, all of those things that you do.
Right, and it can hit every age group, right? The need for an occupational therapist, right?
Truth. You say you have some difficulty as a child in school, maybe control of your trunk or your hand grasp on your pencil. Occupational therapy can be very involved in something like that, and so schooling is that much more accessible to you. It could be a workplace evaluation. So you are at a computer station and we worry about repetitive injuries. And it could be a change in the height of your chair or how your keyboard is set up, that type of thing. Proper breaks for rest period, to stand and stretch to reduce neck strain, things of that nature.
Right, so basically, like you said, anything we do in our everyday activities involves some sort of occupational therapy.
Correct.
Right?
Correct.
And the more we do, the better we are. So that is different. So occupational therapy is different than physical therapy, correct?
Correct. We work hand in hand. Physical therapy generally has a little bit more focus on the lower portion of the body, which doesn't mean it can't involve the uppers, but it is the strength and stability that they have with movement, walking, transferring, things of that nature. Occupational therapy really promotes a little bit more of your purposeful tasks, making your meals, getting dressed in the morning, reducing things like anxiety, depression, stress management, time management, things like that, making work a little bit more controlled.
Right.
Those things.
Right, exactly. Like, for example, if someone needs to get dressed every day, right? And they have trouble buttoning a shirt. Like, maybe you'd work with them and maybe getting a shirt that doesn't need to be buttoned. Or that you need to spend extra time to get ready in the morning. That's where time management would come in, right?
Exactly. And so something as simple as, even if you were still wearing a button up, there are devices, a button hook that makes it a little bit easier when you have arthritic hands or you've come after a stroke of some sort, weaknesses there. Something even like a multiple sclerosis where we continue to lose strength and endurance. You know, you can make something independent for that person, whereas they don't need the assistance of another. Or again, time management, you know, setting things up differently, organizing things so that you aren't exhausted by the time you've just gotten your shirt on.
Right. Sometimes I need that in the morning when I get ready for work. A little different, but that's
Yeah.
my own personal problems, right? So again, you mentioned some of the patients that you usually work with. Are there like certain groups that you work with on a daily basis?
They are varied. You know, we can work with a varied amount in a week. Someone could come in to the hospital with a COPD exacerbation, with breathing problems, or pneumonia, or the flu, or they could have tripped and fallen at home and come in with a hip fracture and need a total hip replacement. They could come in, they had had a stroke, so they are weak on one side, or have difficulty managing words, communication, things of that nature.
Right.
So we work with that. We could have somebody come in with Parkinson's disease, where they are very stiff and have taken a fall because of mobility, or having difficulty getting dressed there, or toileting. Even being in the bathroom independently is difficult.
Right, right. And so, when you mention all of these conditions and situations that you work with, you also work with a lot of other professionals, like you mentioned, physical therapists, right? But therapy is sometimes a group effort, but there's also other disciplines you work with, right?
True, true. We also work with speech therapy. So if someone has come in because of a neurological issue, a stroke, in as an example, they could have swallowing difficulties, and we might have to work on postural strength to get them in a better position, so speech therapy can then work on the swallowing. There could be speech communication difficulty, and so we are trying to teach and train that person, maybe without using so many words, and using more positional and tactile cues for that person. We also work pretty closely with social services. You know, once these people have this illness or ailment or injury, are they able to go home alone and independent? What is their support system set up like? Do they need adaptive equipment ordered to get home? Do they need to over the toilet commode frame so that they can get on and off the toilet and more independently, or a long-handled reacher to help them get their pants on in the morning to reduce excess strain or exhaustion, or the need for another to help. So social services is pretty pivotal in our group as well.
Right, right, exactly. So many people involved with that one person. So when you talk about that individual, that patient, that client, do you help develop that personalized plan, and do you get them involved in that?
Yes, the patient is always involved in their own goals. So when we do an evaluation on someone, we evaluate what is their history like. You know, have they had other ailments, injuries? Were they independent with a spouse and no longer have that spouse? And is there a change there? Do they have a close support system? What are their values? What is important to them? We might come in and see a person and say, you know what, we need you to be independent in making your meal. And they'll say, no, you know what, I don't need that. I can get Meals on Wheels, or I can order food in pre-prepared. But what my main goal is I'd like to get out the front door, and I need to get back to church again. And so we will work on making sure that they can dress appropriately for church.
Right.
And that they can get out that front door and manage that way. So everything is unique to that individual.
Exactly, which is just what that person needs.
Exactly.
Is that individual hospitalization, how often, or how long does therapy usually last?
Well, it varies greatly. So if you have something like maybe carpal tunnel release, say outpatient need, you have gone in for surgery, had a carpal tunnel release, need some outpatient therapy for that. We have an outpatient clinic right down at Route 6, there at the Route 6 Mall, and Karen Stumpo is our occupational therapist there. And she will work with you after that surgery for stretching, for massage, for scar management, strengthening if it's needed, joint protection, taking care of those joints or after surgery so that there isn't such a scar buildup so they can get back to work or life without jeopardizing what is taken care of.
Right.
So you might see somebody 2 or 3 times a week for something like that. If you are in the hospital and you are admitted, you are seen usually at least 5 out of the 7 days.
Right.
We come in and we see you daily, find out what needs to be to go home, and that might be a 15 to 20, 25-minute visit, where with Karen you might be in there 30 minutes, 45 minutes to an hour. If you go to inpatient rehab, you need to leave the hospital. So medically you are stable, but not independent or safe enough to be home yet. And you might have a 10 to 14 day stay there. And you are seen 5 to 7 days a week for usually between PT and OT and sometimes speech, at least 3 hours a day for treatment.
Right. And that's a lot. That's a lot of therapy from all the different, therapies that we have at Wayne Memorial Hospital. And that's that inpatient rehab unit,
Correct.
which again, they don't need that hospitalization, that clinical medical management. They need those therapies to hopefully get back home.
Exactly.
Right?
That is always the goal.
Right, which is so amazing. So again, you talked a lot about that. How occupational therapists help people maintain their independence to where they're at, right?
Exactly.
Which is so important. Success stories. I'm sure I know we can't mention names and stuff like that, but how does it feel? Like, if you can think of one or two examples, but how does it feel when you sit down with someone and go through that plan of care for them, and then when they're done, how successful they have turned out?
Well, it's, what, so much of what we do is about empowerment.
Right.
We can teach you techniques, we can get you to exercise, all these things. The real goal is empowerment. So that is the emotional aspect of this. We always have a physical aspect, but that emotional of, I can go to the bathroom myself and I don't need someone else to help me. I can get home. When I did some home care, I could get somebody in there, and the first day they get to make their first lunch and be able to transport it from the counter to the table and not need to wait for someone else to prepare their meal or something, or get down the front steps because the taxi's coming to pick them up for church. Those are the type of things that just make you so proud of that person because they've realized their own potential.
Right.
That they might not have seen or felt that they could get there. And that's the big plus.
And very rewarding, right? Very rewarding. So what's the exciting thing too is the occupational therapy department and all your OTs got together and you put a display in the lobby, right?
Yes.
So can people go in and see that?
Anybody can walk by. It's literally on your way into where you would go for lab work or check in for any other appointment you have in the hospital. It has a display of what occupational therapists address. There is a questionnaire there that you can answer and put in a box and work towards getting a gift certificate to a local area to eat, an eatery. And there are just little knickknacks that you can pick up there. But yes, definitely worth answering those questions.
Right, and learning more about, occupational therapy.
Oh, truly,
right?
Yes.
Which is so important. So, Kathy, we are just about out of time. If someone is interested to learn more about the rehab services here, can they give a call or go on our website? What's the best thing?
Well, they can go on our website, but they can also call the hospital occupational therapy department. That's 570-253-8147. If they are interested in outpatient services, they can call 570-253-7322.
Right. And they could walk them through the process if they need a physician order and all that stuff, correct?
Correct.
Perfect. Well, Kathy, 15 minutes goes by really fast, doesn't
Yes,
it?
it does. Yes, it does.
I want to thank you again, Kathy Neenan, occupational therapist here at Wayne Memorial Hospital. So thank you.
Thank you for having us.
Oh, you're
It's
welcome.
great to get the word out.
I know. Definitely. And again, this is Carol Kanier. I want to thank you for listening and have a great day.